Welcome to Liv Talks. Today we will discuss one of the most common health concerns in children. I am Dr. Gözde, specialist pediatrician at Liv Hospital City Walk. I have Dr. Fabrizio today with me, consultant pulmonologist and expert in respiratory allergy and sleep breathing disorders. One of the best in UAE. Fabrizio, welcome.
Thank you for the nice words, Dr. Gözde. It's a pleasure to be here to talk about snoring in children.
Yeah. Today, our topic, as you say, we will be discussing one of the most health problem in children, and that makes parents worried, as you say, child snoring. We will be talking about that. And it's a pleasure to discuss this topic with you, as we are working very collaboratively with you, and you are expert in this issue. Welcome again. Yeah.
Snoring is actually not a disease itself, but is something to look at as a symptom because it can be the prodrome of a more important condition for the children. Snoring implies that there is a little bit of airflow limitation during the breathing at night. And if the snoring is without any pauses in the breathing, or if the snoring is not loud, it shouldn't be a concern. It's only about ensuring the snoring is not constant every night, and otherwise looking at the upper airways condition, for example.
Yeah, as you said, you gave the red flags very well, actually. And I want to tell also our listeners how common child snoring. Every 1 in 10 children, we are seeing snoring. And normally, usually, and occasional snoring is not a problem if it's come with a common cold. But if you, as you said, and if it's making breathing issues, sleep disturbance on child, those are red flags. And if it's too loud or frequent child snoring, then parents should be take care of if it's like sleep obstructive apnea, any problems, and that making them and breathing problems. So in this case, and they should come to us, they should visit you.
It's about observation of what happens during the night in your child breathing. For example, you might notice that there are pauses in the loud snoring of your child. Then it might represent a condition called sleep apnea.
Yeah.
Sleep apnea is not only about stopping breathing. Even a shallow breathing it can be considered part of the sleep apnea syndrome. And it's a condition which is very relevant for children because if there is a sleep apnea, even a very, very mild sleep apnea can affect the capacity of the children to learn at school, for example.
That's a great point,
making them more nervous during the daytime because they don't rest at night. So they might not answer properly to the teacher, to their parents, to their friends. And it's not because of they are bad boys or bad girls. It's because they didn't have a good night's rest.
Yeah, thanks for informing. Yeah, this is a good topic, actually. I would impress on this issue mainly to the parents. Yeah, and still they are thinking snoring is just noise, but it's more than noise. Because as you said, snoring affects air capacity and poor sleep quality. We should mention about that. It's very important.
There are red flags, and sometimes these red flags are common to other conditions. If your child, for example, is not able to pay much attention at school, is not performing well at school, or you see his behavior is different than what he was before, you need to consider the possibility that his quality of sleep is reduced, and that might be because of their snoring and apneas together.
Can we give a note here, maybe behavioral changes you mentioned? Mainly parents, they are coming to me with hyperactivity disorder. You know, maybe this is not only hyperactivity disorder, underlying disease, like as you said, it can cause because of the sleep problem. Because a child, if they are sleeping less, if they have any problems with a nasal blockage or any adenoid issue or anything related to making sleep problem, then they are coming with daytime sleepiness and irritability, and those kids seem to be like a hyperactive kids. Actually, they are not. So we are using maybe so much hyperactive DHP, DHP medicine to those kids.
Very correct.
Underlying condition is very important.
It's very important to make a differential diagnosis because symptoms can overlap quite a lot. And there are a few things that even the parents can do. For example, assessing if their breathing through the nose is patent completely or if there is congestion, for example.
Yes.
And if this congestion is chronic or there is sneezing history, we need to look at their possibility of obstruction. Another frequent cause of upper airways obstruction is due to hypertrophic adenoids and their large tonsils, which can easily be seen at the time by a specialist like by an ENT doctor, for example, but also you as pediatrician I'm sure you can assess this.
Yeah,
features.
that's a good point actually, and thanks for mentioning again that. And the nasal congestion, and mainly, pediatrician, they are coming as frequent nasal congestion and upper respiratory infection, common cold. Usually in nasal congestion, they are seeing 10 days, maximum maybe 2 weeks. But if it's continuing more than 2 weeks, a month, nasal congestion, we should take care of the allergy
Correct.
issues. Yeah,
if it's continuous or if it is recurrent, for example, we need to consider the possibility that this congestion of the nose can be due to respiratory allergy. It's quite common here in UAE. About 10% of the people have some kind of allergy. And in kids, this is very highly prevalent.
I think it's increased maybe because of the climate change. Fabrizio, what do you think about this? This topic, humidity is too much also in Dubai, and the humidity all increasing in the world.
There is also the aspect of behavioral changes. For example, once upon a time, children were passing more time outdoor. And nowadays they were more indoor. Therefore, the exposure to the allergens is completely different. Plus, I have to say that the climate of Dubai and the UAE in general doesn't help to go outdoor, especially at summertime.
Yeah. And maybe we should go to other way also. For example, if parents came to your clinic and if they are realizing their children snoring very frequently and so loud, and what is your first step? And how we are managing to the case from the beginning, and how we are assessing the case? Can you explain?
So, if the patient has this issue, it's important to address it in terms of potential causes and the severity of the condition. Obviously, your examination is valuable, and you can already put an indication for an ENT evaluation of the upper airways. But also, as a pulmonologist or a pediatric pulmonologist, sometimes we look at the children with their investigation for sleep conditions. For example, we can do both inpatient and outpatient sleep studies.
Except these sleep studies, are you performing any allergic studies? When parents are coming to clinic and they are requesting so much this skin prick test. It's very popular among the community, and they are all wondering, but there is also a specific IgE blood test we have. So what kind of investigation we are performing in our hospital at Liv Hospital?
If there is clinical history of respiratory allergy and there are symptoms like chronic nasal congestion or sneezing, or even the family history of allergy, then the best test we have in terms of capacity to detect the problem and sensitivity and specificity is the skin prick testing. Now, skin prick testing is very simple. It gives immediate response. So, for example, in the same day, patient comes, does the test, and we can already report what are the allergic sensitivity if there are sensitivities. There is a second possibility is the testing the blood. We test specific component of the blood called IgE, are proteins that are necessary to create the allergic reaction. And their data is very specific, but is not as sensitive as skin prick testing. Still a useful tool, especially we use it in very, very young children between the age of 2 to 5, because we know that some of them can be very sensitive to their prick, which is a tiny pinch on the skin, but there is still a pinch. And so we want to avoid traumatizing the patients with their multiple pinches, and we prefer to have a single blood test.
Yes, usually we are discussing with kids, and if they are comfortable with skin prick test, then we are going with skin prick test.
Yes, it's like a game for them. Quite often they come, they have some tablet to look at the cartoons, because it takes about 15-20 minutes for us to have the results.
Yeah, I usually do that in my practice in the clinic. I am opening a video and the movie, and while they are watching the video, then we are doing the skin prick test, and they are not feeling any pain. It's very painless. So, and also, it's, as you say, this gives very quick result. Then I am referring patient to you if there is any allergy.
Yes, and treating the allergic rhinitis can sometimes make a difference between their young children and young kids to have the symptoms or not. It's not always like that, so it's very important also the rest of the assessment. As I said, both the tonsils and the adenoids are also very common causes of loud snoring and potentially sleep apnea.
So this is why an ENT specialist also should be interfere in this collaboration. ENT specialist, you, allergy specialist, and me, pediatrician.
Well, you know very well, Dr. Gözde, because here in Liv Hospital, we are very used to work in team, and the collaboration between me, you, and the ENT team is great. And I can say only that our patients are really looked after for this aspect. We do have also the possibility to do sleep studies when is needed. For example, in borderline conditions, to make sure that their indication that eventually the ENT might pose for a surgery is appropriate, we can do a sleep study. And for very, very young children, it's better to do as an inpatient sleep study, which unfortunately we cannot provide in Liv Hospital, but would recommend a highly specialized center like Latifa Hospital, which is a dedicated pediatric hospital for children. But for children 6-year-old and above, they can be studied with a home patient sleep study if we are suspecting obstructive sleep apnea. And this is a very simple device which comes with a finger probe. It looks like a watch, and there is not too much invasive. It can be easily done at home without any problem.
It's really amazing to have all this investigation in our hospital and expertise like you in our hospital. And I'm very lucky to have this collaboration with you. Let's say we suspected the allergy and we confirm allergy. And we have medicine. We are also prescribing those in our clinic. Nasal sprays, allergy medicines. But usually I want to give impression, especially this is very important when I am telling the parents, home remedies, changes, environmental factors is very important. Because, and if we remove the allergen, and then allergic diseases, the rhinitis also goes itself. So what is this home remedies? Like usually I recommend to parents like using dust mite covers and making room humidifier less and air conditioner to the room. And what is your recommendation on this?
So it's very important to give a recommendation when we have the information. That's why it's very important to perform the allergy test, which also you're performing in your clinic. And but once we know there is what is the sensitivity, we have a lot of important recommendation we can give. I'll give you some example for the people who have a pet in their house, even if they have an allergy and sensitivity to their fur. It is possible to take action which limits the exposure and the health effects. For example, dry shampoo for the animals who don't like to wash too frequently, like cats, or using special food for cats, for example, which can limit also the production of the allergens by the cat itself. And
it's really good to know.
And there are other actions which are important in terms of separation of the environment between the source of the allergy and the person who is allergic. For if the condition is different, for example, house dust mite is the most common allergy actually here in Dubai. There are multiple actions again which we can take, including their air purifier, which is good for regardless of allergy, because we are living in a country where is exposed to the desert dust, and therefore air purifier is recommendable for air quality indoor, regardless of allergies. For patients with allergy, it's a double recommendation because it also reduces the impact of the allergens. House dust mites are very common, but there are multiple actions I mentioned you. For example, pillow cover, mattress cover, taking action in terms of reducing their exposure to the dust in their environment, but the patient spends more time, for example, at the bedroom.
Thanks very much, Shane, for all expensive and knowledge, Shane. But as you said, and we are seeing sometimes very severe dust allergy. Maybe you are recommending them more specialist treatment, except rather than allergy medicine or nasal sprays. And I see in your clinic you are having.
Yes, it's not only about medication. There is also the possibility to cure allergy. And as I said, this has also an impact quite often in the child snoring history. And the cure is effective, and nowadays we have also safer cure compared to what we had a few years ago. We have both the option of monthly shots or sublingual treatment. We prefer, and 95% of their immunotherapy is given as sublingual treatment because of safety profile, which is much more favorable for the sublingual therapy.
So immunotherapy is right now also popular, and parents are asking. Thank you so much for informing us also in this issue. Maybe last question about immunotherapy. What do you think about the if any cat allergy, any because our child, they like, the girls especially, they like so much cats. And are you recommending those type of animals, any immunotherapy, or what is your recommendation?
As I said, the important is first to confirm the diagnosis. I don't point the finger against the cat because quite often the people might think might be the cat causing the symptoms, and we find that it is a house dust mite or cockroaches, for example, which are also very allergenic. And but once it's established, the immunotherapy can be done for their pets, absolutely. And it's very, very important because, as I said, it has proven to be a very effective way of treating the condition.
Good to know. Yeah, but after all, we did all the treatment to the parents with child with allergic rhinitis, but still children has this snoring issue and breathing difficulties and obstructive sleep apnea. And then we have the surgery options, as you said, with ENT we can discuss. And what kind of condition we can do surgery? If severe nasal blockage on the children, or if there is poor weight or growth and development is affect, or recurrent infection, and we are seeing mainly in my clinic, recurrent ear infection, recurrent tonsillitis because of adenoid and or allergic rhinitis and chronic adenoids. And those conditions, maybe we should be more contact with ENT and parents also. We should discuss about this issue.
As I said, Liv Hospital offers a very, very favorable environment here. And our colleagues don't jump on surgery if it's not really required. And sometimes, for example, we take a little bit of time and see if their medical treatment is effective in controlling the symptoms before considering their surgery. But sometimes, for example, there are borderline conditions where more information like the sleep study can make a difference for the patient's interest to have a proper decision in this regard. And for example, having the knowledge that there is not only about snoring, but is also about sleep apnea, which, as I said, has a huge impact on their child well-being. Or consider, for example, the impact at school or with the friends. Then it can indicate the necessity of surgery like tonsillectomy or the
Yes, you're right. And thank you, Dr. Fabrizio. It was really informative podcast with you. But before closing, I would like to wrap up for our listeners one or two takeaways. And what would your takeaways to our parents and families? What do you think about?
So first of all, take the time to observe your child. And if is loud snoring or you observe pauses or even a reduced flow of breathing during the night, be concerned, especially if there are the symptoms which I mentioned before about the kids to be irritable or not answering properly to their friends and parents and teachers. And also, if you find that your kid has difficulties in learning at school, you should go and check what is the quality of the sleep. The other aspect is the collaboration, which we have here in Liv Hospital. It's very fundamental. The first approach should be with the pediatrician who has the tools and the knowledge. You Dr. Gözde, are an amazing doctor with our young patients.
So kind of you.
And you can observe if there is the indication for the ENT evaluation or there are symptoms suggestive of allergic rhinitis.
Amazing. Thank you so much, Dr. Fabrizio, for joining us. It was really amazing and informative and enjoyable podcast with you.
Thank you, Dr. Gözde, for inviting me here. It's also very important for me to give these messages to the people which are listening to us. And in Liv Hospital, the collaboration that we have is so great that this will benefit our patients.
Yes, you are right. And thank you, our listeners. And if your child is snoring regularly, please talk to your pediatrician. We are here to help you. If your child having breathing difficulties while sleeping or pauses in breathing or any weight and poor weight or developmental problems with speech and or language delay, or if you see any recurrent infection related to this adenoid or allergic rhinitis issues, please talk to your pediatrician, talk to your ENT specialist or allergy and pulmonologist doctor here. Stay healthy and keep those child healthy. We are here to help you. Until next time, see you.